Welcome to the Next in Health podcast. My name is Igor Belokrinitsky. I'm a principal with PwC Strategy, and where I get to help leading health organizations with their strategies and operating models. And in our health conversations, very often we focus on national or even global health players. But today we're going to talk about a change-making organization that is punching well above its weight. And so if you don't already know the SCAN Group, you're in for a treat. And if you do, you'll still be very excited to hear about the plans they have for the future. And so we're very excited today and delighted to welcome Sachin Jain, who's the CEO of SCAN Group, and Renee Delphin-Rodriguez, who's the Chief Legal Officer and General Counsel of SCAN Group. So Renee and Sachin, welcome to the podcast.
Thank you, Igor. And I have to say, you said we were punching above our weight. I think we're getting heavier every single day. So I just wanted to kind of get on the record quickly about that.
Duly noted.
Happy to be here, Igor. Thanks for having me.
Thanks, Renee. And let's start at the beginning. The SCAN Group has a great mission. It has a proud history, but also it has been undergoing some very rapid changes in the last few years. And so, Sachin, maybe you can tell us a little bit about SCAN Group and what makes it so special for you.
So the first thing I want to say to the listening audience is SCAN is not a radiology company. I remember when I first moved to Southern California, I would hear the SCAN name and I would think, what a strange name of a company. And after joining SCAN, I learned that SCAN actually has a very rich history and a very cool underlying name, which is that we were originally founded as the Senior Care Action Network by a group of racially and gender diverse community activists in Long Beach, California, who were all committed to changing the status quo of aging in this community. And I think we all find a lot of inspiration and believe that their call to action is as relevant today as it was then, and that we continue to have opportunities to improve the state of play for vulnerable populations, of which seniors, I think, comprise a big part. We, 3 years ago, with the direction of our board, really, I think, enlightened board, made a pivot away from just being a Medicare Advantage plan, which is what we've been for much of the last 20 years, to going back to our roots and identifying other ways of keeping seniors healthy and independent. And so we've, I think, undertaken a national expansion of our Medicare Advantage plan, but at the same time have launched 5 new care delivery entities, each of which aims to address problems of older adults in different ways. And I think you all know that in December, we announced our intent to combine with Care Oregon to form the Health Right Group. And so over the course of the last 3.5 years, we've grown from roughly $3 billion in revenue to what will be about $7 billion once we're a combined entity, over 3,000 employees, presence in 5 states with, I think, ambitions to go to even more because there's opportunities to better serve people through the work that we do.
That is fantastic. And let us switch from the we to the I would love to hear from both of you kind of what personally brought you to SCAN Group, how it fits into your career trajectory and your aspirations. And Renee, let's start with you and what brought you to SCAN Group.
It's a really great question, Igor. Thanks. A lot of what Sachin said about this moment that SCAN is in, where we are in a moment of expansion, we're looking to affiliate with Care Oregon. We've got our care delivery affiliates that are helping us deliver on our mission. And it's that kind of really special juncture that really attracted me to SCAN. I've been a corporate lawyer for over 15 years, and the transactions and the clients that I worked with that were really meaningful to me were the ones that touched and impacted and improved people's lives. And so when I gravitated to healthcare, it was really because of those central tenets about making people's lives different or better, I should say, and improving kind of how they experience healthcare. And so when the SCAN opportunity came up, it was this perfect moment where my skills and my experience really aligned with the values of the organization. And so that's why I'm here.
It's fantastic. Thank you for sharing that with us. And then Sachin, how about you?
Yeah, in Greek mythology, there's this character, Diogenes, who I think spent his life looking for an honest person, never found one. And I think I would describe my own life and journey as looking for a healthcare organization where I could truly make a difference and really have impact. And I do feel like I've found that here at SCAN, and the opportunity to really take proactive and innovative and collaborative approaches to solving some of healthcare's biggest challenges. We're looking at solving homelessness, housing insecurity, tackling the different social determinants of health, We're looking at really taking a fresh look at health plans in general and asking basic questions like, do health plans actually make a difference? If we were to disappear tomorrow, would anyone be worse off? Why or why not? And really try to raise what I call the replacement value of this organization. There's so many organizations in US healthcare that are essentially commodities. If they disappeared tomorrow, a competitor would swoop in, and the experience for members, for providers, for the community would be no different. Our intent, I think, what Renee and I are trying to do, along with the members of the leadership of SCAN, are really trying to create an organization that has distinctive capabilities that set us apart from the rest of the industry. It's not a secret that health insurance as an industry, has low trust with patients. We may have high net promoter scores as individual companies because people like some of the things we do. But as an industry, we have a lot of distrust and mistrust. And I think we have an opportunity to change all of that.
Well, sticking with Greek mythology, you just have to perform the labors of Hercules now, and then all will be well.
To mix metaphors, there's a little bit of Diogenes, there's a little bit of David versus Goliath going on. And that's another part of the challenge that Renee and I are drawn to, is this idea that we are a $7 billion company, but in the land of giants, we're a small regional entity. And I think in many ways, our modest size actually represents a feature, represents an opportunity for us to be more community focused, to be more human centered, to be more personal in the delivery of our services.
Yeah, I think what Sachin's really putting his finger on is this curiosity that we all have, this drive to look at things and reimagine and think about, can we do this better, right? Like, here's a problem. There are really kind of standard solutions, but are those solutions the right ones? Can we stop and think, is this really meeting a need? And that's really fulfilling personally, but it's also like meaningful to the person who has that need. And so the culture at SCAN is to be curious, to drive for excellence, to reimagine solutions to these problems that many seniors have.
And I don't want either of us to come across as like toxically positive, which is a big problem we have in our industry. We've got our warts too. Every day is not a sunny and shiny day. We have the same challenges that lots of organizations do. But I do also think we have some advantages, and those are the things I was referring to.
Sachin, I'm going to give you an opportunity to be negative here in a second. So wanted to take advantage of having you on the podcast. And there are many pundits out there. Many people talk about healthcare. Your voice out there in the industry is quite unique and distinctive and provocative. And so would love to hear your view on what's the state of play in the health industry today. What does this current moment look like? What makes it different from what came before?
I think one of the biggest concerns that I have is that we are not speaking clearly and honestly enough about what some of our challenges are within the industry. We are an industry that loves to soothe ourselves with happy talk. Value-based care is going to save the day. We believe in health equity, when the actions don't necessarily match the words. And I think if an organization is going to commit to health equity, they've got to commit to health equity. They've got to move the needle. They've got to commit to move the needle. They've got to challenge themselves. They've got to change how they do incentives. Otherwise, it's just happy talk. Value-based care is another example of that. I think we've had the payment models in place to move from volume-based payment to value-based payment for more than 10 years now. I was part of the founding team at CMMI, and those payment models are now getting dusty. And people are saying, oh, well, we need to move from volume to value. Again, I think many organizations aren't making the bold moves to do that. I think we've got a real state of play where the lines are very blurred between for-profit and not-for-profit. We at SCAN, I think, take our not-for-profit status very, very seriously. I think a lot of organizations operate much more like for-profit organizations and do things that are anti-community, anti-patient, anti-people. And yet, if you look at the words on their walls, their mission statements, their community benefit reports, their annual reports, it's all what I call happy talk, the epidemic of happy talk in the industry. And I think happy talk is more dangerous than it seems. I think most people would say, oh, what's the big deal? It's just what organizations do. They have to tell their story. They have to put a happy face on their organizations. But when you engage in this nefarious happy talk, some of what you're doing is like papering over problems. And so people think that these problems that exist are actually solved or that they don't exist. And so some of what we do is speak a lot of truth about some of the challenges we have within SCAN. The fact that we are a Southern California health plan and we have not enrolled as many minorities as we should. And, that's a big health equity challenge for us. We're a Southern California health plan with minorities where even though we have 4.5-star performance times 6 years, if you actually look at the different sub-indices, we perform differently with our Black Latino members than we do with our Caucasian members. And that's a problem. So again, I think it's okay to be proud, but simultaneously challenge your own status quo. And I think in healthcare, we have too many organizations that are proud, but aren't challenging their own status quo. And that's the big state of play issue. The other thing I'll just say is that, and I referenced this earlier, we've just gotten too big. There hasn't been enough antitrust enforcement. And we've gone from having small community-based organizations that were exquisitely focused on serving the people down the street to big corporate entities that have anonymized both healthcare workers as well as communities. And any one of us who has been a patient in US healthcare knows what this feels like. It feels like calling your doctor's office, and rather than talking to your doctor's receptionist, you're talking to a central call center that isn't able to get you in front of your doctor later that day if you need to see that person. You're waiting 3 months, 6 months, 9 months for a primary care appointment. And so bigger is not better. We haven't proven that bigger is better. There's no one who's proven that bigger is better. It hasn't really proven out for patients. And so again, I think we have to start speaking truth to power a bit more and challenge our own conventional thinking and really just try to be better every single day. I think there's a certain level of malaise and indifference that we've arrived at the broken status quo that we have.
That's a great perspective, and I hear you. And we have published in the past on the consequences of consolidation in healthcare and that it doesn't always produce the promised improvements in quality or affordability or equity. And so let's stick with equity. And Renee, I want to bring you into the conversation and very excited to have you on, first chief legal officer we've ever had in about 150 episodes. And it was fascinating in preparing for this to hear from you that you own health equity and it's in your organization. So would love to hear about what that job is like. And this whole organizational construct was equity sitting within legal. What does it look like? Why is it set up this way?
Wow, that's a big deal, Igor. First chief legal officer in 150 episodes. The legal department at SCAN occupies a very unique space in the organization, and it is unusual that legal has oversight of health equity. And so I think it was deliberate and it was purposeful because it speaks to the uniqueness of what our role is. We're super integrated. We work across and alongside multiple business lines and multiple departments. And as Sachin was referring to, like we've got this curiosity and this demand and drive for excellence, and the legal department asks probing questions and we look to find solutions to challenging problems. So we're constantly kind of analyzing our work. And so these attributes and this mindset makes the legal department a great fit to kind of oversee and put our arms around the various work that we're doing around health equity. And so that's kind of what we're trying to do.
I would say another thing, Igor, about her team, you've got so many different perspectives represented in our legal team that I think this group of people in a lot of ways is very well positioned to be supporting the health equity needs of the whole company. And that's why it's one of the reasons why diversity matters as much as it does, is if you are trying to serve a diverse population, having a diverse team really enables the kind of leadership that's necessary. And that's why I think it's perfectly situated with Renee and her team.
Absolutely. Representation matters here. And so give us a sense for like what kind of conversations would the two of you be having about health equity? I mean, Sachin, you already mentioned some of the metrics that you're monitoring and so forth, but what types of discussions are you having with each other on this topic?
Yeah, I mean, we think of health equity as not just kind of a race-based thing. We think it cuts across all segments of society. And that's why we do have initiatives to close disparities for different racial groups, but we also have the industry's first LGBTQ plus focused Medicare Advantage plan, our Affirm product, which grew by more than 600 members in the last year. We have our Healthcare in Action medical group that's focused on improving the care of people who are experiencing homelessness. And we've now housed more than 100 people and have cared for, I think, close to about 2,000 patients here in Southern California, where homelessness is a major epidemic. We're going to be launching some new products this fall that are, again, first in industry type products that focus on specific populations that have historically been underserved. So I think we're serving health equity purposes, both from a medical group perspective. We're also serving it from a health plan perspective. I think the other thing that we've done is really just challenged our whole organization to think about how do we grow to serve more diverse populations. And we've grown significantly in the Asian American population. I think, multiplied by 6 the number of Korean American members that we've served in the last 2 years through creative partnerships with different medical groups. And again, I think we're just getting started. This is like very early in this organization's health equity journey. And I think Renee's leadership is going to provide us with a lot of new perspective and I think alignment between our business purposes and our health equity goals and directives as a company.
Very cool. And so Renee here with Sachin listening to this, what's the kind of the big question on your mind that you'd pose to Sachin, that you'd pose to Scan Group? Like, what's the big question in equity that you believe that needs to be answered?
It's a good question. I think rather than posing like one really big question, I think it goes back to what Sachin said about this happy talk and this toxic positivity, right? It is amazing that we have this first in kind Affirm product, but we're a year in. So now we need to go back and we need to look at it. We've got 600 plus members, which is remarkable. And that's a great accomplishment. But is this product design, is it meeting the needs of this group that we designed it for? What's the provider experience? What's the member experience? What's the data telling us? I think the question is not so much what is health equity? What does that mean? I think it is more specific question that we need to be asking each step of the way. And I think the Affirm product gives us the ability right now to look back, like I said, we're almost a year in, and think about, did we get it right? What tweaks could we made? What improvements could be made? What did the members say? And so I think it's this constant questioning, this curiosity and wanting to make sure that we're meeting the need and making the improvements.
Yeah, I mean, what you're hearing is really our drive towards authenticity and not just celebrating ourselves because we did something first or did it well, but really just being critical and being our own best and worst critics and taking a hard look at everything that we're doing and turning over every stone to be better. And I think that analytical drive that Renee described is going to be the thing that's going to allow us to achieve new heights. I think one of the things we see across the industry is just so much like vapid press releasing and $100 billion companies announcing $2 million investments in health equity, a fresh food farm in some community somewhere, when there's a whole country to fix. And I think we have to start demanding more from the big players in healthcare, and we have to start demonstrating the art of the possible. And what we see our obligation as a Scan is being the first to do something. Like, so our hope is that in launching an LGBTQ plus health plan product, we'll look back 5 years from now and every MA plan in the country will have something like that to better serve this population. But we'll be on to doing our next first, serving another group of people who have been underserved. And that's how change happens. And that's our theory and model of change here is we demonstrate it and then others copy us. I mean, that's kind of been Scan's history for many, many years. We were among the first health plans to talk about social determinants of health way before it became cool to talk about social determinants of health. We were doing it. Now, everything that we were doing, everyone else is doing. And so that puts pressure on us to keep leading, keep finding, new mountains to climb.
Well, speaking of that, and we're called Next in Health. So tell us what's next in health. Tell us what's next for Scan Group.
Renee, what do you think?
We're going to conquer the world. No, next for us, I think we've got a lot on our plate. We've got the Care Organ affiliation. I think you've alluded to some things that are coming up this coming year with product design. So I think that's what's next for us.
What I would say, Igor, is when you look around the country, regional not-for-profit health plans are struggling. They're struggling because there is this David versus Goliath theme that is emerging. Healthcare is either going to be owned by a few big companies, or we're going to have to find a new way to compete against those big companies to be better. And I think part of what we're trying to do with Health Right Group, with the Care Organ combination, with some of the creative M&A work that we're thinking about, the new product design, the new subsidiaries we're launching, is to, I think, put into play strategies and organizations that are, in some ways, are category creators. And that's what we're doing with the LGBTQ plus product. So we're not thinking about competition in the same way anymore, which is like, how do we win the war for benefits, or how do we add more network partners so that we have a broader network? We're thinking about how do we create a new dimension of products, a new dimension of services, and reimagine things. I talked earlier about reimagining the role of the health plan. I mean, what a health plan should do is the thing that I'm able to do for friends and family anytime somebody has a new cancer diagnosis or has a new healthcare crisis and their family. If I get a phone call like that, I will pick up the phone. I will mobilize literally every resource that I have at my fingertips, social capital, relationships, to get the person the appointment that they need, to get the person the care that they need, to get them to the expertise that's going to make a difference in their lives. That's what health plans should be doing for patients. It's not what SCAN is doing today. It's certainly not what any other health plan is doing today. And so, again, some of the work that we're doing is just reimagining what it means to be a health plan. Because I would tell you, I think when people ask the question, like, do we need health plans in the United States? If the answer is too complicated and can't be explained easily, then we're not doing the right things. And so I think we're a little bit off track as an industry. And we got to go back to what is the distinctive benefit that we can provide to people that they couldn't otherwise get if we didn't exist, and just go back to first principles from that perspective. And so the way you change an organization, the way you change an industry is one bite at a time. And so my hope is that in 10 years, if you look back, we will have evolved into something completely different than what we were right now. Again, that kind of change comes incrementally. It comes in small steps and pieces, but that's the journey that we're on together.
Well, we really appreciate you making it so clear and so compelling and so distinctive for us, and doing it in the spirit of curiosity and avoiding happy talk in favor of real talk. So very inspiring.
Igor, I would ask you, you interact with people across the whole healthcare industry. So I would love to just kind of put this on you for a second. Why do you think we have so much happy talk? How do we get organizations out of their happy talk? I understand happy talk when it comes to broader employee messaging, but what I think I really struggle with is how many leadership teams at healthcare organizations engage in that same happy talk. And they talk about the mission when in fact, what they're doing is they're denying claims and answering the phone. So I'm just kind of curious, what you think about that as a seasoned senior healthcare consultant in our industry.
I do believe it is very hard to get the kind of feedback, the kind of measurement that you're looking for. And you brought up, we have a plan. How is it doing? We have all these efforts. What kind of impact are they having? It is just technically very, very difficult to measure the impact of a lot of actions that we take in healthcare. We have so many different entities doing so many different things to individuals and communities and populations. It is hard to know which of those things are working and which of those things are not. And the ones that aren't working, it is hard to tell whether they're not working because the dosage is too small, or we're not sticking around long enough to let them work, or we're doing something completely different. Our theory of change is completely different. And so partly because of that challenge, it's much easier to measure effort and to say we spent this many hours, we put this much money, we did this many photo ops. And it's a lot harder to say I did X and it produced result Y. We just have not invested, have not discovered, have not researched enough to be able to show those causal relationships. And that is a small but fairly significant barrier and obstacle that we have on the road. And those are the kinds of tools and technologies and analytics that we're trying to build to pull data from a bunch of different sources to enhance it and to give people a lot better feedback loops to know if the things they're doing are actually working.
But do you think that there's enough conviction in our industry to change? I mean, my observation, I started out in government, then I was in pharma, then I was in the delivery side, then spent time in and around hospitals, now health plans. And I just sometimes think the conviction levels are just really low. I mean, that the crisis that we're experiencing is less a crisis of policy or measurement or analysis, and in some ways more a crisis of leadership. That we have people who've kind of just come to be satisfied with being successful, even if we're not very good. And what I mean by that is you can be a highly paid healthcare executive in this country by just kind of getting along and not doing anything particularly spectacular or interesting or challenging your own status quo. So why would I? And I think that comes from a basic leadership compass problem that we have as an industry.
Sachin, I wonder if part of it also is that we've forgotten that healthcare is different, that we've forgotten healthcare is about taking care of people, and we've kind of made healthcare like everything else. And that when you do that, you take away that specialness and that care. And that's probably why you became a doctor, why my father became a doctor, right? That drive. But somehow that's been muted. And it could also be part of like, no one wants to make less money, right? And if we were to truly do value-based care, we would be delivering less care or less of certain types of care and spending less money. And maybe that's also something that is just an uncomfortable idea. So that's my thought about a different perspective on your question.
And certainly we hear you on this question of leadership and even ownership and like who owns these issues, because any meeting you go to, the fingers start pointing, well, no, it's that group's fault or it's that organization that is making things challenging and creating obstacles and producing waste and inefficiency. And no matter how big you are, you still feel like an underdog. No matter how big you are, you still feel like there's somebody else, some other entity. But if not, you'd make so much progress.
Yeah, I mean, it's interesting that you say that. When you say everyone feels small or like an underdog, I mean, I talked to a CEO of a really big plan, all lines of business, a state blues plan, and they're kind of talking about how they're feeling subscale. We're a single line of business, and that's got a predominance of membership in Southern California, extending and expanding to other geographies, and we feel small, and they're like 5 times or 7 times the size of us. It's just interesting how that perspective shifts, or it remains the same regardless of the circumstances of your situation. But I do want to go back to this idea of a leadership crisis, because I kind of have now landed on this, and maybe I'll just stay with it for a while, is as the real reason that healthcare is not getting better in this country. I mean, for like early part of my career, people talked about not having enough science of improvement. That was like the theory, like there's not enough analytical rigor. Then the next part of my career, we talked a lot about policy and the fact that we didn't necessarily have the right policy instruments. And then Obamacare was passed, and there was CMMI, and value-based payment became in many ways normalized. What I see is the lack of uptake of a lot of value-based care models. You do a lot of value-based care work, Igor. We've had Medicare Advantage for how many years? We've had a number of other instruments through which people can implement value-based care. And I would say, writ large, the implementation has been uneven. It's been spotty. The results have been super mixed. And the level of conviction has been even more mixed. There's a big academic health system in Southern California that just announced that it was going to leave the Medicare HMO business altogether. And that's their strategy. At the same time, everyone's saying we need to move from volume to value. And so, again, I just think we're in this world where we say one thing, we do another, and then we wonder why we're not getting better. That, to me, all comes back to leadership, authenticity, and the level of conviction that you're bringing to things. And to Renee's point, the willingness to cannibalize yourself. If you're in a not-for-profit business, you should be willing to have lower revenues over time if that's what is in the best interest of the patients and communities. But we have, to Renee's point, I think, transported too many for-profit models into healthcare, into not-for-profit healthcare. And so bigger is always better. More revenue is always better. More profit is always better, when that's not necessarily the case in something that is oriented around benefiting the community.
Absolutely. And another thing you're hitting on is, in addition to leadership, there's innovation, not just innovation in some new life-saving treatment, but innovation in a governance model, in an ownership model, in a reimbursement model, in a new type of plan that you may be launching. And then there's Renee's point around part of being a leader is making near-term sacrifices for longer-term benefit of your organization, of your customers. So very, very compelling. Excellent. Well, it has been a delight and a privilege to have you both on, telling your story and telling the story of Scan Group. And really grateful to both of you. Thanks, Renee, and thanks, Sachin.
Thank you. Great to be with you, Igor.
Thank you.
For more on these topics and other health industry insights driven by policy, innovation, and care delivery changes, please be sure to subscribe to our podcast and check out the past episodes. Until next time, this has been Next in Health.
This podcast is brought to you by PwC, all rights reserved. PwC refers to the U.S. member firm or one of its subsidiaries or affiliates, and may sometimes refer to the PwC network. Each member firm is a separate legal entity. Please see www.pwc.com/structure for further details. This podcast is for general information purposes only and should not be used as a substitute for consultation with professional advisors.